very exciting.
This is Bharat FM.
बजेगा भारत, झूमेगा भारत.
ये है भारत FM.
बजेगा भारत, झूमेगा भारत.
Good morning, namaskar. I am Ridhay Rawal, the host of Rubaru. Welcome you all to Bharat TV and Bharat FM. We have the most delighted and the most respected Sherill K. Williams and Bradley D'Souza from Ohio, United States of America. So Sherill is the president and CEO of Prevent Blindness Ohio. So Sherill, can you let us, our audience, know that what Prevent Blindness Ohio is, as Prevent Blindness Ohio is spread all over the United States, and what specifically it is doing its operations in Ohio, where you are the CEO?
Thank you. I'm excited to share all of the national organization and our good work across America. And obviously in Ohio specifically is where I met Bradley and his family. Prevent Blindness was founded way back in 1908. I wasn't born yet then. Maybe you weren't either, Herday, and I know Bradley wasn't.
Nope.
So it is a very, very historical organization. Way back in New York City, 1908, it was a group of people who gathered together who were concerned about babies being born blind. They got an infection as they came through the birth canal that caused blindness if it wasn't treated. And this concerned group of citizens formed together to make and found the organization Prevent Blindness. And what they accomplished is still something that is being done today. And that is they advocated for a law that required that every newborn get drops in their eyes to kill this infection, whether they knew they had it or not. Just every newborn would get these drops. And that killed what is called ophthalmia neonatorum, or baby's sore eyes. So from that early days of 1908, the law being developed and implemented in 1920, we have grown and expanded all of our services to include everything that prevents blindness and preserves sight. We're all about prevention. We make sure that folks don't needlessly lose their precious gift of sight. And how do we do that? Kind of like the Eyes Open International organization, and their goal is to empower people about human trafficking. We empower Americans, Ohioans, with information that they need to protect their own gift of precious sight. And that is to get regular eye exams, even if you think you can see well, because so many eye diseases will rob sight and you won't even know it. And sight that has been robbed, like through glaucoma, for example, can't be restored. So the only way you know you might have something going on in your eye is to get a regular eye exam. Also, when doing projects around the house, auto mechanics, certain jobs, make sure to wear eye protection, because 90% of injuries to the eye that cause blindness could be prevented by use of proper eye protection at home, at play, and at work. So that is how we empower people, is with information. And we also, if folks don't have the finances or the wherewithal to access vision care, eye exams, etc., we have programs that provide free access, equitable access to vision care. And that's something I know we want to talk a little bit about more later, because we have many examples, including Bradley and his family, that have accessed this program.
So when I was researching about PBO, I went to your site, and there I can see many government officials and retired army officials in a board of directors. And also we know that PBO is a non-profit. But is PBO is a non-governmental or associated with any government or something, or who do you partner with?
Well, we partner with many organizations. In fact, I just did a count yesterday because I'm putting together a resource. In the state of Ohio, we have 791 partners. Their schools, their health clinics, their clubs and organizations, their trade associations like the Optometric Association, the Ophthalmological Society. And the way we do our business, and this is why so many people maybe don't even recognize our name, Prevent Blindness, and we've been around over 100 years. They'll go, who's that? Who's Prevent Blindness? I've never heard of them. Well, it's because we kind of are a business-to-business organization where we share our resources, our credibility, our information, our training to other organizations so that they can spread it to their networks. So, for example, we partner with hundreds of organizations in doing vision screening. Prevent Blindness doesn't come in and do the screening for the people they serve. Let's say it might be a senior center and they've got senior folks that are using the senior center for meals and healthcare, et cetera. We go in and we train staff and volunteers at the senior center to do vision screening so that when we leave, they can continue to do vision screening for all time to come and not be dependent on our small staff to come in and deliver the service. And the vision screening training we offer is standardized, scientifically evidence-based, and always implemented the same way so that we make sure that there's quality in the people we train and certify and that the equipment is the best equipment available that we provide to them. So donations that come to us help provide that free training for folks to serve their constituents. So our partners are many and varied. And, well, for example, another type of partnership is a partnership with a social service agency. In Cincinnati, Ohio, for example, we have partnerships with organizations like SUCASA, like Lincoln Heights Federally Qualified Health Center or Community Health Center, with Santa Maria. And all of these groups serve many needs of people. Food insecurity, healthcare, substance abuse, a whole variety of things that these agencies work with folks on. We offer them access to our free eye care program because folks often might have a vision problem as well as many of these other situations. So when SUCASA, for example, has a client that has a vision problem that they discover through a screening we've trained them to do, SUCASA then refers that individual to us through an online application, and we get that individual plugged into a free eye exam, free pair of glasses if they need, medication if they need, and surgery if they need, so that all of the uninsured and underinsured folks without access to eye care shouldn't have any roadblock in accessing that eye care. There should be a person in the state of Ohio that has a problem, or America, getting that eye care when they access our program. So that's our partners, and we couldn't exist without our partners. And really, in a way, the way I've been raised and all of my career life with Prevent Blindness, and before that with the March of Dimes, Birth Defects Foundation, the best way to reach the most people is through others, and not to hold, an ego that you have to do it yourself or it's no good. So we help people to fish. We teach them to fish. We don't fish for them. And then they have more ownership and empowerment as well.
So moving straight to the most talented and athletic, Bradley D'Souza. So when you say athletic, I have read that Bradley, you have been into many sports and that you have won many championships at national level. So in which sports you are in?
More my brother than me for the national level, but I'm a fan of tennis, and then I guess recently athletic. I just started, or in 2019, I took up running a little bit, and then finished my first half and full marathon with roundabout no training, but just by a little bit of perseverance that way. And then my goal this year March. In May, I have a half Ironman, which is a 70.3 3-mile race. So it's 1.2 mile swim, 55-mile bike, and then a 13.1 mile run. Training for that is going slowly, but if everything goes well, I should hopefully finish in a decent time overall. But I picked it up very much as a way to stay active and just stay fit, mainly because I enjoy tennis, and as I get older, I can't be a ball boy as I was a decade ago. So to maintain some level of speed and athleticism for that, that's kind of always been my underlying motivator to stay fit.
That
I didn't
sounds
know you were doing the Ironman. Where
Was
is
it?
it going to be? I didn't know you were doing the Ironman challenge.
The one I've got currently, unless something changes with a lot of the sporting events, of course, are very tied to COVID and Corona, because if anything happens, they have to be very precautious. But it is going to be in Florida, in Panama City Beach. I tried to pick a very level playing field, just since it's my first time doing it. Try to keep as many of the outside factors to a neutral as possible. There is one in Columbus that I've been eyeing with, but I think it's got a couple of hills and things. So I want to work my way up to the more difficult ones. And I think the one that like people get very nationally recognized is the one in Hawaii, and you have to qualify for that one. And that one's also a full Ironman, which is 140 miles. So that one will require a little bit more planning and training for sure. But baby steps, even though I say that, I think I've skipped a few to try straight for an iron or half iron, but it's definitely a little bit exciting and nerve-wracking at the same time to put the body through that.
So Bradley, is there any specific training do you follow for competing the Ironman, going into that competition?
There are actual trainings. I'm not very good at following those, but there are trainings, because you practice your swimming, you practice your biking, you practice running. Ideally, you practice them in some variation all within a day, so that you can know what your body is going to be feeling as you're switching, because it's a continuous race, of course. And then I don't know. I know that when I was doing marathon training, they say you kind of work your way up to about 80 to 85% of the actual full race, and just get really good at getting to the 85%. And then the last 15%, you train your body up for, but you never actually practice. And then you just do that day of, because it's going to hurt, and you also know that it's going to push your body kind of past. I personally, and this is very much me, and again, I'm not an athlete or professional athlete in any way, so my take is always, if you're going to be doing it, to really push towards that and see if you can do more. It definitely hurts a lot more, because you shouldn't be doing half marathons before you actually race a half marathon or something of that nature. But I haven't been doing anything specifically training wise. So in my downtime and work, I'll go for hikes, and I'll go for just to stay outside and just stay active that way. But I'm very bad at structured training, but the organization for the Ironman has plenty of information that way as well, for things you should be doing, benchmarks, staying active and things. So if you're more structured for working out and for training, there are plenty of resources. If you're free flow and free form like me, it's a little bit tougher, because I don't thrive in a gym environment. I don't really thrive in those things. I'd much rather be out and about and taking in the sights and doing something that way, and then happen to accidentally also get some physical fitness in, because it requires some hiking, it requires some walking, it requires, going without water for a little bit because of the difficulty of the hike and things.
So when you talked about ball boy, I remember your few pictures with many of the famous tennis celebrities. Can you talk about that something?
Yeah, so except for last year, because the tournament was postponed, the last 13 years, I've been a ball boy. So it's been quite a while, and it's always something that I look forward to every year. I think it's the only thing that has been from like something that I do that's consistent outside of my work, where once a year, I always set aside those 9 days to go down to Cincinnati, and it's like summer camp for me effectively, because there's plenty of other kids and friends that have been doing it for about as long. So we get to see each other once a year for 9 days. We get to run around chasing tennis balls, catch up, be on court with the pros. I think I have some of my greatest stories from in between matches, but then of course during matches too. Yeah, getting to be first person view of how a professional hits a tennis ball, like plays. I think the best tennis for myself, for my brother, is almost always right after we've been on court, because you really get it gets burned into your eyes, like that experience. So it's definitely one of a kind, and anybody that especially now I get a lot of people that ask, and that's a volunteer thing, so it's something that anybody can really do as long as you're willing to tire yourself out and run around chasing tennis balls. I know that the age group, for the most part, of course, the younger you are, the faster you are, and you have more energy to burn. When you're getting old like me, for a tennis age, it gets a little bit tougher to kneel down and have the sprint. But if, for me, that's where I put in the little bit of extra work so that I can keep up with the teenagers and still have a little bit of a competitive edge.
So switching to the point that how you are associated with Prevent Blindness Ohio, I have a video to show to our audience. So let's see it first, where you and your dad and your mom are speaking about Prevent Blindness, and it's a very beautiful video.
Born in India, my whole family moved to the States in 2003. My brother and I were essentially keeping each other alive, since my parents were both working 16-plus-hour days. Neither of us really slept in a bed. We would always kind of try to stay up as late as we could to hope to get to talk to our parents and get to see how their day was.
When we came here, we were immediately made to work, and Harold and I did not get paid for the longest time.
It took us a long time for our whole family to realize what was happening.
We were working at a restaurant. We started our days early and ended it late at night. I confronted the perpetrator and said, you need to just pay us our dues. This conversation was heard by one of the chefs. And that is when we actually got ourselves out of that situation.
I think I realized I had some level of vision problem about 4 or 5 before we came to the States. School definitely was a big challenge at the time. There was a lot of schoolwork that was really poorly done just because I couldn't see. We got put in contact with an organization that helped us get my eyes checked and get me a prescription, an updated prescription, which was much overdue, and then a free pair of glasses with lenses.
Those pair of glasses has really made his life prosper.
When we were in our trafficking situation, my only out was community service. We did a lot of different kinds of community service with our church.
It was my mom who really started volunteering, and then about 8th grade or so, it was me who was kind of dragging them along because I wanted to go do one more organization or one more event or one more community service project. I think my responsibility and my work in the community has really been where a lot of my accomplishments have shown through, where I got recognized for a lot of those programs in regards to leadership.
I think those new pair of glasses made all that difference. Being a member of the National Society of High School Scholars, he was invited to be the ambassador for them. In 2013, he got invited to the presidential inauguration at DC. And recently, he got invited to the Nobel Week at Stockholm. He was one of 25 kids from around the world that was invited to the Nobel Week.
Vision is like a freedom. You can go from destination A to destination B with confidence and with clarity.
Together, we can end avoidable blindness. Join us to help the world see now.
Aren't we lucky? Aren't we lucky to have?
That still gets me.
I get tears every time I see that. Bradley feels like my son. I've known him for so long.
I get speechless with that video. because of they did a good job tying everything in, and then of course all the core parts of our story, and then the help that Sherry was able to help us with, and I think that was in 2017, I think, if I remember correctly. And the work has continued since then too. So I'm speechless, and like mutter onwards with my speechlessness for a while because of it.
Well, one of the things your dad said in the video was that we think the pair of glasses made all the difference. And I don't know if we can be that braggadocious about that making all the difference, because there's a lot of gumption and ambition and miraculous kinds of things that this family and many families have been able to do because of what's inside them. But I do have to say, when Bradley was young, and we look at what kind of learning takes place through your gift of sight, 80% of what a child learns is through their gift of sight. So to remove that barrier from the other barriers that Bradley and his brother got a pair of glasses, his mom and dad got a pair of glasses through our program, removing that barrier is just such an easy, wonderful thing to do when there are so many other challenges one is facing. So hopefully it helped a little bit in widening Bradley, his access to education and to reading, to learning, to performing well in the academic environment that contributes to his success now. So to see it, I mean, I'm still like, I could cry any second now here. So I've got to breathe a little bit. I'm just so proud of what he's done and the tiny little bitty part that we played in all of it. I am humble about, because it was a tiny little part, but it just is amazing at what you've been able to accomplish, what your family has been able to accomplish.
Thank you. I mean, and I'll jump off of that too, right? Like it's not small, but it's very core to everyday life. And I've said it, I think, before, and I say it every time. It's like we take it for granted when we have it, because it's just you wake up, you can look at your phone, and the fact that you can look at your phone or you can look at anything is really the thing that was solved by me getting glasses, and me not having to like squint and not having to worry about anything, and having to go through extra work to be able to go through day-to-day life. So it's small, only I think is like the incorrect word, but like important and foundational is probably more key, because it's minor only in like speak, but in terms of what I was able to do, or what any family, anybody who gets the help is able to do off of that is monumental. And it really allows you to then believe and push the limit for what you're able to do, because you can see it, because you have vision for your day-to-day life, and then you're able to really start planning 10-15 seconds out, and you can go from there forward into the future for what you want to do and how you want society and world, and you can get bigger and bigger and more macro from there. But like what you were able to accomplish from that just stems from and I feel like I'd heard it, but I didn't know, as you were saying, like the drops that getting put into every newborn, like that's that foundation, and it sets up that proper base work for every kid, every adult, everybody to do what they can to the best of their ability.
Well, and what you said about, you just don't think about it. You get up every day and you take your vision for granted. That truly is our biggest challenge at Prevent Blindness, is that people don't think about protecting their vision until they're faced with losing it or have lost it. And it's really difficult in empowering people to incite them with the excitement and the behavior and the incentive to actually take steps to make sure their vision is healthy and well before they lose it or before they're faced with losing it. So that is our challenge. And that is what I ask everyone listening today to do. is to make sure that you're keeping regular eye exams at least every year if you have a diabetes, every other year if you are pretty healthy and well. Take advantage of vision screenings. It should be regular, even if you say, I can see fine. You might be able to see fine, and you could be losing your sight slowly to glaucoma. So, or age-related macular degeneration could be developing. There are so many vision problems. In fact, right now in the United States, there are 41 million Americans with either blindness, visual impairment, or one of the 4 leading causes of vision loss in adults. And those are cataract, glaucoma, diabetes-related eye disease, and age-related macular degeneration. 41 million. And unless we do something to curb the growth, because all we baby boomers like me are getting old and we're living longer, unless we do something to curb the growth of that vision loss through research, through being, good, healthy people and going to the eye doctor regularly by wearing safety eyewear, that will double by the year 2050. Double to 82 million Americans by the year 2050. So this is a considerable problem. What does it mean? It means when you're kids, we've talked about Bradley already, and his brother and his family. When you're children, you tend to have roadblocks to your learning because you can't see the board, you get headaches, you've got eye stress. Also, something you may not think about is that children who don't see well don't socialize well. They're the last ones to be picked for the kickball team because, they're not very useful members of the kickball team if they can't see the ball. So they become more isolated and less socialized, which isn't a happy thing to be when you're a kid. When you're an adult, your work productivity suffers by 19% if you have uncorrected vision problems. So you're not completing as much work. You're not able to move up, and get promotions and work safely. And then all ages, especially in the senior population, just think of what vision loss means. It means you may not be driving your car, so you're not mobile. Your world all of a sudden becomes limited to where you can walk. Falls, talk about walking. Uncorrected vision in seniors 65 and over in age. 25% of falls are due to uncorrected vision. And falling when you've got bones like I do is not a good thing. We always hear that grandma, grandpa, etc. Have fallen and they're in the hospital, and then, other things start to happen. Falling is not a good thing. It's the number 1 cause of injury in our population 65 and over. And 25% of those falls have the vision, a lack of vision as the key. So mobility, independence, very important things. We treasure our freedom and our independence so much. I know I treasure mine. And to think that there was something I maybe could have done to avoid losing that freedom and independence of mobility in my daily life is just the kind of empowerment we're looking to give people to take care of their gift of sight.
So Bradley, when you received the treatment of your eyes, you were of 13 years of age, am I right?
Mm-hmm.
So after that, what made you feel that yes, I should volunteer for PBO, I should joining the PBO and help others? What made you think such?
So, I don't think I'm okay with it, but I don't think I've ever been really good at accepting help, and some of it just comes from that. Like it was necessary, and I'm forever grateful that it was there at such a pivotal time. But from there, I'm very much the believer of like you have to pay it forward, and you have to allow that to impact other people. So through high school and college, when I was in Ohio and in Cincinnati, especially, wanted to do my part to share my story, being that it's a little bit different than most, and then the impact that it's had on me and continues to have on me. And there's there's countless times in a year that I'll wake up and I'm just glad that I can see and glad that I can do something. And anytime that I'm thinking back on some of my more crazier stories that I've started to accumulate over time, all of them come from the fact that I could go do that, but then also that I could see the site and actually take it in and enjoy it, because that's where the story is really coming from, is my firsthand view of it versus me saying, oh, I went there, I couldn't see anything and I came back. That doesn't, as Sherry said, your world gets really small when you have no vision to tie it in from your perspective, or even to share for outside. So always from that perspective of when I had time and ability to, when I was there, to be able to do it there. Now, unfortunately, just by being that I've had to move I moved to Illinois and then moved to the West Coast. It becomes a little bit harder to go back to Ohio, but I make sure to at least do what I can yearly from a contribution standpoint. And then Sherry knows if anything's ever there that I'm able to help with, she can give me a call, and I don't think I've ever missed a phone call or a text, but if I have, I'm sorry. But anything that
Maybe there is some network issue.
Yeah, I can't hear Bradley.
Really? Can you hear me? Yeah.
While Bradley is figuring out his audio, I can tell you that I, started to get tears in my eyes again, because he, of course, is humble. And when he said he always tries to help out and he's been through many experiences with us, it brings back a memory of when I received an envelope in the mail at our office. It was from Bradley, a card, and I opened it up, and he was maybe 16 years old at the time. And it was a note from him and a check. And he said, he used to call me dearest CEO, respected Sherry, or something. I mean, that was enough to make me start to cry, because nobody is that respectful to me except Bradley and his family. And so I opened this note, and he said, I have my first job now. And I don't know if your audio is working, Bradley, but wasn't it like at a cell phone store or something like that?
It was Paycor. So I got my first paid internship in high school through Paycor, and they help with payroll and HR services for business to business, right? So they help that way. And yeah, I mean, sorry, I think my mic died, but to it means a lot to be able to do at least a little bit. And from my perspective, the least I could do from me first being able to contribute to society in a productive manner, and then give back to the people that helped me get to that specific point, was just I think those first few paychecks, especially just to the organizations, to the people that allowed me to get there, and then allowed me to be able to grow from there. And then I make it a point at least to grow from there, and not lose that aspect, because just to keep grounded, and then just to be able to genuinely give back and keep contributing in whatever way I'm able to as I grow.
He contributes to this day. And let me tell you, I lost it. I did. I sat at my office and cried and said, here is his first paycheck coming to us. Because I didn't even ask for it. It just came in total surprise. That is the true meaning of philanthropy, is taking an account every day of your blessings and giving forward, not looking back, but giving forward, and without being asked. That is the wonderful thing about the work that I do, is that it exists on philanthropy, totally donations is how our organization exists, charitable contributions. And that is the kind of thing that I work to teach my daughter. She didn't learn as well as Bradley, but she's doing all right. My granddaughter, who volunteers, she's 4 years old. She volunteers, she gives back, she collects her toys and brings them to Goodwill and so forth. So important to do for others, because it makes you a better person. It makes you so much more grateful for all the things that we've been blessed with in our lives. So that was, quite an event for me that I'll never forget, where I was sitting, what I felt, and I've kept that card to this day. I have it in my purse, actually. I carry it around in my purse. It's kind of tattered now, but, and Bradley grew then into a position with our board of directors. He continues to contribute within his own means at a very generous level. And he has brought others on board, and has, you saw in the video, promoted and advocated on behalf of our national organization as well. And we showed that video in connection with what is called Eyes on Capitol Hill. I think you said in 2017, which is when all of our volunteers get together and go to Washington, to Capitol Hill, and bring our message for access and support to our lawmakers on Capitol Hill. And that was a part of what we shared with all of them during our visits, was the story of how important vision is and how it unlocks all kinds of keys to education, independence, mobility, job productivity, academic success. And Bradley was our spokesperson through that video.
Wow.
So, he's had impact nationally. He was a speaker at one of our national meetings
Yes.
a few years back. Sat at the same table, had a lovely visit, and then he shared his story with all of our volunteers and leaders and supporters nationally. And I have ideas for a program that Bradley won't be able to say no to, that we'd like to be involved in next, called our Aspect program, which is a program that actually trains and makes available advocates to visit our state legislatures, our national legislators on Capitol Hill, and also there are many companies, pharmaceutical companies, other kind of companies, that will ask for patient and consumer advocates to sit on their boards. And this prepares folks to do that as well. And, you can't be too busy, Bradley, when the invitation comes, because I think it would be, wonderful for us to have your representation. And you might,
Absolutely.
Meet some new folks as well that will be helpful to you, spread your message. So there's another program called the Aspect program, and it's run by our national organization.
Happy to help.
Good.
So was the Bradley the youngest board of director at that time, and he is still the youngest, means he has retired from this post, but is anyone younger have ever been made board of director then after Bradley?
I think at the time I was the youngest, but I don't know about since, just because of time that's passed, but I can let Sherry.
You were the youngest ever on our board of directors. We like to have every year a youth representative, and we like to have patient representatives on our board, as well as a whole diverse variety of people. Bankers, eye doctors, public health people, patients, all kinds of diverse folks coming from different backgrounds and, different walks of life. And yes, Bradley was the youngest ever on our board, and he kind of almost broke the wall to us, making sure that once his term was up, we always had a young representative on our board as well to give the youth perspective. And the representatives we've had have all had experience with Prevent Blindness, like Bradley as a patient and an advocate. We have a research program, a scholarship program we fund for young female scholars in vision research. And we've had a couple of those researchers who are, in their early 20s. be a part of our board. Right now, we have an individual named Kylie Glass Gang, who is on our board of directors, and she has been affiliated with us since she's 10 years old. She's probably a little bit younger than you now, Bradley. And she was born with congenital cataracts. And her family went through all kinds of, discovery and suffering, and until they were able to find out what was wrong with her vision and have the surgery. So she is our current youth representative or younger representative, but Bradley kind of set the pace. He was, he's the first in doing lots of things.
No.
Let's just, add that to the list of the first of doing lots of things.
Yeah.
A trailblazer, I think we call it, right? You're
I try. No, I mean, and I learned so much, from an organizational perspective. I just gained so much more respect for the inner workings and, how much goes into the campaigns themselves, and really seeing, it takes a lot to be able to, and Sherry's being very modest and saying like they help advocate, but the amount of training and, the outreach and the network of people in Ohio, and then of course across the country, that are able to help and really spot these things and be advocates and really guide people. My time there, I'm just really understanding all of the work that got put in, and at such a large scale, you have to be very careful with how you go about it, because it has to be done the right way and done correctly, and with care and understanding for different people's situations. So it was, just being able to be part of that for my term was incredible. And I'm glad that there's been, for me, being able to do it at a young age, of course, just helps keep me well-rounded and just know what's there. And then I'm excited that there's been other youth that have followed to really gain that experience as well. And then that really helped for me as well mold the fact that, when possible, to continue to contribute and to really, keep up and make sure I'm doing my part, because it's a lot of work, and it's, as much as I wish it was something that I could do every single day, it's not necessarily my calling in that regard, but I do want to make sure that I'm able to be a part of it and be able to help in whatever way that I'm able to, my story in contribution and otherwise. So I think that those years especially were very formative for me in understanding the organization and just gaining a whole new level of respect for everything that Sherry does above and beyond on.
Well, that's good to hear. And that does, bring up the other side of Prevent Blindness, and then nonprofits in general. There are 4 million nonprofits in the United States of America. A lot of nonprofits. In Ohio, there are 40,000. And out of those 40,000 nonprofits in Ohio, Prevent Blindness, the Ohio affiliate, is one of 39 that have achieved what's called the Standards for Excellence certification, which is a voluntary program you can go through where you're kind of given a real deep dive physical and a look at all of your operations and so forth. And we're just so proud to be among, the 39 out of 40,000 that have achieved this certification through the Ohio Association of Nonprofit Organizations. And it's because there is a real responsibility, and Bradley pointed that out as a board member. You are entrusted by the public to invest those donation dollars in the way in which we have promised they will be invested. It's not our money. It's the money of the donors that they have given in good faith and trust to reach the mission of Prevent Blindness, and that is to prevent needless vision loss and to help people see better. So, very important job. And it is through our volunteers like Bradley, our board members like Bradley, who have legal responsibility for making sure that happens, that we are transparent and that we are always conscientious about making sure that we stick to our mission and invest those dollars exactly where we've promised they be invested.
So talking about dollars, I have taken a few screenshots from the website, which you already said very correctly that you are very transparent. You have all the list of donors of 2019 to 2020. You have what revenue you are generating and what expenses you are doing. You have all the things available on your website for the audience to see. And Sherry, when you talk about that program, so how can people get registered to that program through your website, or is there any something you can give some details about that?
Yeah, I think you're going to put up our annual report and our revenue. One of the pieces of being a transparent organization is to make sure you get a professional audit so that outside forces are looking at your books too, not just your board, which has oversight, and your staff, but that there's an outside auditor that looks at your revenue. And here is what our revenue in Ohio was and our expenses for the year ending March 30th, 2020. So for about a year ago. So we're about to end another fiscal year in a couple of weeks here in Ohio. And you can tell, $2 million is a lot of money, but it really isn't when you look at the fact that we're serving every Ohioan. We have 11 million Ohioans, and really that is our target population for our services, because those are folks that we want to make sure protect and preserve their precious gift of sight. So the general public, the consumer of eye care, patients of eye care, are that's who we represent. We're sort of the lobbyists for them and the programmers for them. So when we look at what it costs us to reach everyone that we serve through a direct service, I think it's probably around $1.71. We call that return on investment. For every person we serve and reach, we do it for a very reasonable cost of $1.71. So we reach 1.2 million people with $2,012 in revenue. That's part of transparency, and that's part of a well-run operation, is that you really look to stretch every dollar, because the more people you serve in a quality way, of course, the better off we are in reaching our mission. We don't want to leave anybody out if we can help it. We want to expand our resources to their greatest extent. So we'll see where we end up after a pandemic year, but hopefully Herday and Bradley and I were talking about this year of the pandemic and how we thought it would only be a month and then 2 months. And well, here we are at a year of very different operation. I was so proud of our organization nationally, Prevent Blindness National, and then Ohio, in how quickly we adapted our services, because we do training of folks who serve others to do vision screening. We were able to move our training onto virtual platforms within a couple of weeks. So while we were, doing in-person trainings, workshops where we were gathering in person, up to that point, we realized that we wouldn't be able to do that. You couldn't have more than a certain number of people in a room and so on, spaced out and what have you. So it made training people to do a skill kind of a challenge. So we put everything online, and this, with the help of our national organization, you can now participate in a free training to equip you to do vision screening for kids or adults in a self-directed format where you can plug in and take it at your own pace, take the tests, and then have a face-to-face on FaceTime skills assessment. Or you can join kind of a Zoom webinar where you're able to live ask questions and see the training and participate in the training. And then hopefully, one day we'll be back to some live in-person trainings as well. But immediately we switched over, and the response was overwhelming. People were getting trained and certified so that they were ready when those kids or when those seniors came back to their service facilities, that they were ready to help provide this service. They had all the equipment they needed. They had the skills they needed. I was so proud of what we were able to do, and also of the folks that we trained, because they were using the time that things were sort of down or closed to build their skill and their ability to get back to, 100% plus service when the pandemic started to loosen and to lighten up. In the case of the program that Bradley talked about, where we match individuals who need eye care with service providers, with eye doctors, we move that program to all online so that our partners, like we talked about before, Sukasa, Santa Maria, the federally qualified health centers, schools across the state, were able to conduct a verbal vision screening if they were not able to be meeting with people in person, and then to submit an application for eye doctor services online through a portal. And as soon as eye doctors opened up, they were really kind of only closed in the state of Ohio for about a month and a half or 2 months, where, everybody was in a lockdown. But we were keeping a waiting list during that time. And when they opened up, the program began to flow again, with us matching everybody who applied, no matter where they lived, with one of our donor eye doctors that come to us through a company called BSP, and also through Luxottica's charity One Sight, and then a variety of regional providers across the country as well. But we are so grateful for the donations of eye exams and brand new eyeglasses through these donors that operate throughout the United States of America, that we're able to find the folks who need it. That's the role we play. We find the folks who need this care, and then we match them to an eye doctor that's part of that system. So we're really proud and, kind of amazed at the innovation. It's fun to innovate, and to be sort of forced to innovate makes it even more fun, because you're kind of on a race against the clock. And when you're guided with your heart, wanting to make sure that in really tough times, like it's been this last year, in tough times, that's the last time you want to turn people away who need help. That's the last time you do. So it makes the inspiration even, I think, stronger to get the job done well, to get it done quickly, and to make sure folks are aware that this is still available, that we haven't closed the door. In fact, the door is even wider open.
So these numbers are very interesting. Your revenue is $2 million and your expenses are more than $1.8 million, where most of your expenses are being going towards public health, community services, and you are spending only 15% for fundraising and administrative purposes. So your most of the funding is going for the welfare of the society. That's very interesting and very noble cause. We have also this picture from your website where we can see that you have 5 chapters going on in Ohio. Northwest Ohio, Miami Valley Ohio chapter, Southwest Ohio chapter, Northeast Ohio chapter, and then statewide. So can you describe to our audience what these chapters are, and how can people get access to this chapter if they have any offices in respective areas, and what else?
Yeah, anybody that is looking for services in Ohio can call us at 1-800-301-2020, or go to our website, pbohio.org. Easy. If you are not in Ohio and are wanting to access information and services, the phone number is just about the same. It's 1-800-331-2020. And the website for national services is Prevent Blindness, one word, preventblindness.org. So it's very, very easy to access help, to access information. If you want to email us in Ohio, it's info@pbohio.org. So we will be right there and responsive to serve you and to meet your needs, to take your donations, to find out if you're interested in volunteering and helping, to be trained as a vision screener. There's so many opportunities to help to bring our mission to life, and to make sure that more individuals are saved from needless vision loss. Half of vision loss is needless. Can you imagine? Half of the people who have, either blindness or visual impairment wouldn't have to have had that if they had had regular eye care, early detection and treatment, and protected their eyes from injury. So that's sort of what keeps us going, is knowing that half the folks out there we can save through empowerment, personal empowerment.
So a couple of questions before we end our show. Bradley, we have heard that you have also decided to donate some of your will to PBO after you die.
Mm-hmm.
So what's that thing actually, and how can people can also do that? Can you say something to empower other people that we can donate to
Yeah,
the
so and this is actually one of the few things I learned from my time on the board, and I wasn't aware of how that did. So like that was really, really cool in that regard. But through from my company and from not, like, you have beneficiaries to your estate in the event that you pass and you go on. And for the longest time until I learned about it, it was always just my younger brother, because he's younger than I. So by logic, he should be surviving me. But by learning about it too, I really did consider. I was like, well, I could have it all go to him, and then write down something of here's how it should be divided up, or I could at least do certain percentages. So he still gets a heavy percentage overall, but I do have a healthy percentage that goes directly to prevent blindness in the event. So essentially, as part of the estate, whatever that sum will end up being at, hopefully a long time from now, that's already essentially, I don't want to say written in, but it's already essentially there that that percentage goes directly to them in the form of a charitable donation. And then it's for me to, like I said, I don't ever want it to be that I'm, distance might like grow in terms of physical distance, but my support and my awareness and my advocacy for the organization is always there. So by doing that and then yearly contributions, I think that's there, and it at least gives me a slight bit of peace of mind that for whatever reason that the organizations that I care about are getting some level of support in my passing. Essentially, I don't like to think in doomsday terms, but that's essentially the best way. And there's no pain to it, and it's not really anything to it. It's so much as something that I believe in, and wanting to make sure that I'm doing my part to pay it forward and contribute with my actions as much as with my words. So in regards to just about any financial institution, you're always able to control the percentages for beneficiaries. You're always able to add multiple ones. So all I had to do was just add a secondary one, make sure that it's an organization versus an individual, and then allocate a percentage to that from the the 100% of whatever that pot will be. And to me, again, it's just peace of mind that in that event, there's those things are already done. It also means that there's less infighting for whoever wants a hand in whatever that pot will be at that time.
So when we saw your video a few minutes back, there we came to know that you have been invited for the Nobel Prize, and you have also been invited in the White House. So can you share something on that?
Yeah, so from a lot of my work in high school and through college, primarily in high school, and then hopefully as some things go, I'll be able to do some more cool things in the future as things open back up. But I was able to go for the inauguration in 2013 for President Obama's second term, and then in 2016 at the end of the year, got to go to the Nobel Week, where got to watch all the laureates present their works, and that was a small group, and that was in Stockholm. And both of those were through organizations that, especially for high schoolers, for, I don't want to say high achieving because I don't consider myself a high achiever, but for people contributing and doing their part, they're able to take advantage of those organizations. And to tie it back into today as well, though, like they're able to take advantage of that to go see those things, and those are once in a lifetime opportunities. And then also being able to actually witness it, seeing it on your TV screen, of course, is monumental whenever something cool is happening. But being there and really having your own perspective and your own input from it and from your own eyeballs, and it gets ingrained into your brain, right? And that the feeling that you get from that is one of a kind, and I think that is really the message that I keep from that is like I think back to those things, and it seems like a fever dream sometimes because I'm so grateful that I got to go to it and that I got to be a part of it, and I think to this day some of it I still can't believe that I got a chance to do, because there was so many things that would have had to align from me being able to see, me being able to go contribute and do things, and get to a point where that opportunity did present itself. So always grateful for that. But yeah, definitely, I think for the inauguration, it was the National Society of High School Scholars, and then for the, it was National Society of High School Scholars for the Nobel Week, and then it was the, I'm blanking on the full form, but NCIS, I believe, for the inauguration for National Collegiate Scholars for the inauguration. So as a former high schooler of Pride, I think that's one of those things that the organizations are there, and just being able to be a part of your society, and grateful for the society that's around you and the people that help you grow every day. If you're willing to be grateful and then pay it forward, I think just good things happen from there on in a broad scope.
Yeah, of course. So, sir, is there any outreach program or any programs which we left to talk to our audience about PBO?
Well, again, certainly there are many opportunities for involvement. And we have opportunities for involvement as a volunteer. You can be a member of a committee, you can be trained to vision screen children, you can be trained to vision screen adults. If you need eye care services and are uninsured or underinsured, you can access our vision care outreach program and have us match you up with an eye doctor to do an eye exam, brand new pair of glasses, that sort of thing. Certainly, too, you can advocate for policies that widen access to vision care and join our advocacy team. We do a lot of our advocacy through Eyes on Capitol Hill, and a lot of it through letter writing and phone calling as well. So there are a lot of ways to be involved. And Bradley, you may think of a few more as well, being part of our board, etc. So we invite everyone who has interest to engage with us, because it really does take everybody to help meet the mission. But most importantly, everyone who's listening can live our mission by getting regular comprehensive eye exams by an eye doctor, an optometrist, or ophthalmologist, and making sure never to skip eye protection, because the time you skip it might be the time that something happens and you lose vision or your vision is compromised. So if everybody did that, we would be reaching our mission. So share that with your family, loved ones, neighbors, employer, etc.
Sure, we are supporting your mission, and yes, we will spread that. So one last question to Bradley before we sign off for today. Bradley, we have read and heard that a biopic film has been made, is under process on your father, Mr. Harold D'Souza. So what do you feel about it?
I'm excited. I mean, it's my story is not possible without his story, and I'm as somebody who's been slowly pushing in the background to really have him get to this point. I'm really excited for what we'll develop and what will be there. And there's still parts, it was a very traumatic experience for him. So there's still parts that I'm not fully abreast to. So I'm excited that that's sort of, being worked on. And then as from an awareness aspect from Eyes Open International and beyond, the story will really be more all encompassing, and knowing him and my where I am, like the I know that if all goes well, like it'll really be from the best intentions and with that awareness aspect, and won't be done in a poor manner where we're not proud of the work and proud of the work that we've done to get to where we're at. So genuinely very excited to see what that's there. I do take the approach that the less I know, the better, just because with everything going on, especially as everyone's kind of running around, unless there's something that requires me, I try not to bother him with his work and let him really enjoy it. So the project's really being done that way. But I'm very much in support and very excited for seeing that final product. And I think I've had only 1 or 2 conversations so far in regards to it. So the bit that I know is exciting nonetheless.
So it was very nice talking to Sherry and Bradley. We will finally sign off for today. We will support PBO and we will ask our friends, relatives, and we'll spread the word to go to your site and contact you and save the world. Thank you. Thanks a lot. Bye.
Very good to see you.
Good to see you. Thank you.